If you're a teenager or a mother of one and you have some questions about teenage acne, then this video will give you all the information. Hi, I'm Dr. Sana Bhamla from Kaisha Skin and Hair Clinic, and I'm going to talk to you about teenage acne. What is it? Why does this happen? What is the most common form of acne that you see in teenagers, and how do you deal with this? Towards the end of the video, I'm also going to touch upon some commonly asked questions which may have probably crossed your mind too. As simple as it sounds, acne eruptions in teenage boys and girls. Mind you, 70% of teenagers experience these kind of eruptions. This is simply a byproduct of the hormonal changes that are happening around puberty. You may see acne eruptions as early as 6 months before you see other signs of puberty. Improper diet, a disturbed sleep schedule, both of which have become common part of a teenage lifestyle. They have definitely a contribution towards teenage acne. Most commonly seen eruptions are blackheads, and more blackheads. You may also sometimes see pus-filled or reddish acne. Early treatment is key here. As we allow the hormones to naturally settle and stabilize, we have to simultaneously decrease the impact that it is having on the skin. A customized skincare prescription is very essential. This should contain anti-acne creams containing salicylic acid or adapalene or tretinoin, and a good skincare routine which is mostly containing a non-comedogenic cleanser, non-comedogenic moisturizer, and a silicone-based matte finish sunscreen. If blackheads are many, then you must go ahead with extractions after chemical peeling. Now, extractions done after chemical peeling are the easiest and they have the least amount of chance to leave behind a mark or a scar. Choice of chemical peels would be salicylic acid or lactic acid depending on the skin type. Now coming to answering your questions. Is it necessary to treat teenage acne at such a young age? Well, yes, and yes. And I will tell you why. You have to understand that whenever an acne, especially a blackhead, when it is staying in the skin, it is creating a space or a home for itself. Once the acne heals and goes away, the space or the home remains behind in the form of a mark or a scar or a hole or a pit. And the journey back from there is really tough and long. There are safer and milder yet effective treatments available for teenage acne, keeping their age in mind. Isn't it normal in a teenager? Well, for 70% of teenagers, yes. But in no way can acne be labeled as a normal condition. It is a condition that has a potential to leave behind sequelae, many which can be permanent also, if not treated early and correctly. My child is too young. Is it necessary to do peels? Well, I won't say it's necessary, but these are the clues that you need to look for to be able to decide that for yourself. So if the acne is not responding to the home care, or if there are too many blackheads and then they need extraction, or if marks have already started forming in, then in such cases, if you combine it with chemical peeling, it's only a boon to these patients. You must know that there are safer options available in peels also to treat teenage acne. In the end, I only want to say one thing. I get a lot of adult patients who started as teenage acne, and they literally tell me that when we were teenagers, we were told by someone that please take your acne seriously and now. So if you still have that chance to do it for yourself, then you must take it.